Good morning, ma'am. I'm going to perform assessment of Perilite exposure and purpose, application of dry heat to perineal area in order to provide this comfort and increase blood circulation and hasten wound healing by means of perineal lamp. We have the assessment. We have to check the client's condition before applying the procedure. And ma'am, are you feeling okay to continue our procedure? And then we have to gather all equipment needed, Perilite lamp or heat lamp. And then we have our blanket, and we have our perineal um, flashing set. And then we have to check all electrical equipments for defects or try to switch on and off. Then we have to always handle the equipment with dry hands. Implementation, check physician's order for each area to be treated and duration of therapy. Then we have the performance. Identify the patient and introduce yourself. Good morning, sir. If we have the client is unable to express herself or talk, we have to check the risk tag to verify her name or ask significant others to verify the client's name or patient name. And then we have to explain to the patient what we're going to do and why it is necessary and how he or she can cooperate. Mom, I'm going to perform assessment of Perilite exposure, and it could be it could ease and hasten your wound healing. And then we have to perform hand hygiene and to prevent any infection control procedure. We have to perform hand hygienes or wear gloves to prevent any infections. Measures. And then we have to provide client privacy by closing the door, or we have to close the curtains. And then we have to render perineal flushing. And then dry perineum thoroughly and remove the bedpan. And then we have to place the heat lamp under the blanket about 18 to 24 inches from the perineum to avoid burning, and patient put the Perilite from 18 to 24 inches. And instruct the patient not to change position or touch the lamp. and remove lump after 15 minutes or as ordered by the physician. We have to remove the lump after 15 minutes, and then we have to check the area of reaction. And then we have to reposition the patient for comfort. We have to inspect the equipment regular basis. And then we have to document the findings in the client's record using forms of checklist, supplements, and narrative notes when appropriate. Do aftercare, return equipment to proper storage. You have to return our equipment to proper storage, and then we have to um, document the findings of the client's recording using form of checklist, supplements, narrative notes when appropriate. Do aftercare, return equipment, proper storage, perform follow-up, and for the evaluation, perform follow-up basis based of findings that deviate from expected normal for, for the clients, relate findings to previous data of available, and then report any significant deviation from normal to the primary care provider.